Okay, so we're off. Okay, so John, thank you for joining me. You're the Head of Commissioning, Partnership and Performance from South Gloucestershire. And today we're talking about carers, unpaid carers in South Gloucestershire, ready for Carers Week, which is the 8th to the 14th of June. And I'd like to welcome you to this time from the Carer Support Centre to talk to us about your role. Is that okay?
Yes, thank you, Sam. Thank you for the opportunity.
Thank you. Is it possible that you can tell us a little bit about what's happening in South Gloucestershire for carers?
Yes, if I may. So I'd like to start, if I may, with saying that the immediate thoughts of everyone at South Gloucestershire Council are with the families who, through COVID-19, have lost loved ones before their time. That's deaths that have now reached 149. And whilst those figures remain lower than in some other parts of the UK, every untimely death is a family tragedy. And our relentless focus over recent months has been on minimising such tragedies, and we have pushed that up the agenda as being the #1 issue for us. It's been unprecedented times, and it's brought a fresh range of challenges for everyone, I think. And carers have certainly been at the centre of those challenges.
Yeah.
So I certainly want to open by saying that empathy with families who have suffered, but also to thank every carer for their contribution and dedication. And I'd like to highlight aspects of that with what I've got like to say as we go through. So many people have been affected, and everyone's circumstances will be different. And I wanted to try and illustrate that by just picking out my own experiences and that of Denise Swain, who's kindly agreed for me to share that. And Denise is our commissioning manager, whose remit includes carer services, and maybe I think many carers reps will recognise her name and know her. But for me, my own role has in adult social care has meant considerable refocus of attention and effort during recent weeks, as you would expect. My wife is a frontline NHS nurse. My daughter is a frontline healthcare practitioner. Our niece, who lives just down the road from us, is a frontline A&E nurse. Our mother-in-law lives on the south coast. She's in her 80s, and she made the decision to self-isolate. That meant giving up all of her faith-based informal network of carers at a time when her son, my brother-in-law who lives nearby, was placed on the shielded list and also needed to self-isolate. The only nearby family member who was left, who we thought might be able to help her, is a frontline NHS nurse at Bournemouth Hospital, and was given a lead role in running their COVID-19 ward. The support to my mother-in-law has been a huge challenge, and I won't bore you with the details, but I think many carers will have their own set of circumstances which are absolutely unique to them and how it's affected their family. Yeah. Denise Swain hasn't seen her mum, who lives on the other side of the country, since March. She had been travelling every 2 or 3 weeks, spending 3 or 4 days with her at a time, and we've adapted her working pattern to accommodate that. So her caring role has been much reduced because she couldn't travel. And so whilst she's had less to do as a carer, the stress and anxiety and sadness about how she is coping and the impact this has on the isolation and general health and well-being weighs very heavily on them both, really. And it's a damage to relationships. Communication is difficult, and her mother doesn't understand why Denise hasn't been to see her. No. And I don't think that those two examples will be far from what many of the people in South Gloucestershire have been affected by their own families. It has brought people closer together, with carers in their broadest sense and key workers being held in greater esteem. And that is something that local authorities and their partners have been working to achieve for many years. I think we've seen a change in the perception of the public about carers in their broadest sense, which has to be welcomed. It's sad that it's taken such an event to maybe do that, but it is one positive. Within local communities as well, we've seen the spontaneous formation of community mutual aid groups, offering help and support to those in the community who require it during lockdown, through a network of local community volunteers. I stopped counting when the number of those groups in South Glos went above about 70. We've linked and coordinated with them and published their contact details and made a 7-day per week helpline available so that carers and everybody in the community can access the support that they need and make those calls if they need help. But having that group of spontaneous community mutual aid groups has been a great help to us, and I'd like to pay credit to those people as well. The coordination of those groups has been done by Southern Brooks, and our ease at which we've been able to slip into operation with the community voluntary sector organisations in South Glos has been a great credit to them. So as well as running the 7-day-a-week helplines for the public, carers, everyone in South Gloucestershire for anything they need in relation to COVID-19. They've also been linking with the community mutual aid groups, doing Zoom calls with them every week, as well as the established community and voluntary sector volunteers and the statutory sector to make sure we deliver responses to all the calls that we receive. Very early on, in the pandemic, we redirected the work of our information advice and guidance team to focus solely on developing and publishing COVID-19 online information on the council's web pages, including information for carers, and we're continuing to update that information on the bespoke area for COVID-19 on our website as information emerges. A really key challenge during this pandemic has been how to support those who normally receive community-based support and or daycare. When the day centres closed, as they were required to do, all our social workers had conversations with those attendees and their families and carers about the support that they would need and would need to be delivered during lockdown, and the pattern of ongoing social work contact and support they needed. That has been a considerable challenge, given that many people who attended day centres have been self-isolating, and any support that is given must respect that and not prejudice those people and place them at risk and make them vulnerable to the virus. As a consequence, we have definitely seen a range of issues. We have seen additional safeguarding issues. And we've also seen some innovative ways of continuing to provide support online, by phone, and one-to-one with social distancing. Remember that care workers are still going to people's homes, and we have still had staff who were running day centres doing one-to-one support instead of the group sessions in day centres.
Okay,
so we've seen those day centre staff adapt the way they deliver services and actually take new referrals using new methods. One day centre has used its staff to continue one-to-one support, and currently they are supporting 35 more people than their day centres were pre-lockdown. So it's quite interesting to see how they have been able to actually expand their service in different ways. We have been supporting the providers of social care. We temporarily uplifted fees to care providers whose work has continued, and we've also supported them by, as a provider of the last resort, really sourcing and providing personal protective equipment to all care providers where they have a need and their existing supply lines haven't been sufficient. As a part of a key effort to protect carers, people who receive our services and the care workers. We've also continued payments to services, including day centres, where they have been unable to operate as normal. And it is important we take reasonable steps to protect them and sustain those services so that they're able to resume when appropriate. And supporting providers is in this way is important, albeit an indirect method of supporting carers. There is evidence that there has been more carers, clearly more carers during lockdown. I think the examples that I gave of personal examples illustrate how that will be so common across the country, really. We have seen people, many people who have received particularly home care service, asked for those services to be paused during lockdown because they want to preserve the integrity of their self-isolation. Now, many of those people have reported to us that they're able to sustain that because they're able to access support from family members, or more support from family members during lockdown. Some have said, we've got a relative who's furloughed, my daughter's furloughed, she's going to support me. But clearly that means hence there are more carers, and existing carers are doing more. That those statements tell us that. In addition, there's been some increase in applications to work in care services, and that's welcomed. And together, that has meant that those who have been waiting for a home care service have actually experienced shorter waiting times between assessment and commencement of care packages, with waiting lists during lockdown have more than halved. But when those informal carers, family carers, go back to work, and when people start to move out of self-isolation, clearly that's a position that's going to change again. So that support from informal carers has entailed, is one example amongst many really, accords with the national picture from Care UK, Caring Behind Closed Doors, which showed that 70% of carers are providing more care than before. And over a third are providing that care because of the closure of or reduction in local services. I would like to stress, if I may, the importance of carers' assessments and the signposting and support that can arise from these. And that includes direct payments for carers, which, as we all know, enable many carers to take a break from their caring role, although difficult to do so at the moment for reasons that we know because of the rules around lockdown. I was very pleased to see that during the lockdown period that colleagues from the Carer Support Centre have been able to reduce the waiting time for those assessments. And in our conversations, we've stressed the importance this year more than ever, really, about being creative with support planning to meet the carers' needs and ensuring that the budget that we have for direct payments for support grants is fully expended. And again, working with yourselves at the Carer Support Centre, delighted how we've been able to streamline how quickly carers are informed of the outcome of their assessment and through the introduction of the trusted assessor model. So we've seen that, meaning that in most cases decisions about the next step following assessment is made by the Carer Support Centre, and carers are being informed of that within a couple of weeks usually from what we see. We do think that having a key focus on minimising fatalities, minimising deaths, that and the having to observe lockdown rules, and that across a wide range of social care services, we need to think about scoping survey work as we move forward to engage with people, including carers, to gather their views following COVID-19 experiences, particularly to perhaps hear what people want to retain, what they want to return to go back to doing as we did, what they want to resist returning to, what do people expect us to deliver differently in the future, what do providers in the community voluntary sector want us to do or do with us differently, and any radical ideas and innovation that we need to kind of build on. What's good, what's bad, and learn what we have all been through in this experience, so that maybe we hear about the new normal, but actually maybe there is, and we hear about words such as reset. Actually, it perhaps isn't about going back to what we were doing before. It's about learning from what's happened, keeping the better parts of it, but learning what didn't work well as well, and being honest about that as to where attention has not been focused and perhaps it should. And I know that the Carer Support Centre has already begun thinking about such a carer survey, so that we can capture those views and learning opportunities can be reflected upon. Carers assessments, carers' needs will continue to be discussed and explored in the 3 conversations model, so that the council is considering service user and carer needs. We have been continuing with our assessments face-to-face where it is necessary, but we have been risk assessing whether that is necessary and whether it can be done in other ways. So again, to follow the guidance, to minimise the risk of exposure of people to the virus, service users, carers, our staff, we have been risk assessing, and where it's possible to do it by online, by video, by phone, we've done that. Where it needs to be done face-to-face, we have done that, but with a plan, with PPE, with social distancing. Carers groups, the remote support is continuing, so they're not meeting, but again, to respect the rules, but remote support is continuing, and carers group facilitators are in touch with individual carers and organising group contact. I mentioned PPE a few times, and of course it's received national attention. Carers can now access the council's stocks of PPE, and we've finalised a message to go out for carers. For many it won't be necessary, but it is important to know, again, if people are struggling, that there is assistance that we can give with the stocks that we have purchased and are holding to support the care providers more generally. And the key focus is on the cared for person is ill, or a carer travelling to support someone and the person shielding or personal care is involved. So I'd kind of like to conclude really by just repeating thanks, echoing a kind of the message that we know that we need to, in a period where we've been extremely reactive and having to make some things happen, and we haven't been perhaps as proactive to reflect upon where the gaps have been and learn the lessons of the good and the bad of how it's been for others, but we know that it's been a huge challenge for everyone, and we're very grateful, and I want to express my sincere thanks to everybody for that. And with that, Sam, perhaps I should pause to allow you some questions.
Thank you, John. I think that's really refreshing to hear that update, actually, because whilst we've been in contact with carers from South Gloucestershire, we are hearing really positive feedback about the services and the support that they've received. So that ties in with what you've just updated us on. So that's really refreshing. So thank you. I mean, in terms of making caring visible, you've talked about the carers assessments and carers making sure that they sign up for that. And how have they been recognised and supported during COVID-19? You've kind of talked about that quite broadly, and that's something that going forward carers really need to be aware of, that they are entitled to a carers assessment every year. And in South Gloucestershire, you're really good at sending out a reminder to people that their 12 months is coming up and that somebody will be in touch with them to revisit their caring situation. And I think given that you do that as a reminder, given the change of circumstances with the pandemic, that's even more important right now for people, and they really value that.
Good, thank you.
That was a bit of a closed question, sorry. And I think in terms of, I think you've probably answered all my questions in your presentation. Yeah, I think we're good, because you've talked about day services, and it's really interesting to hear that actually your day service workers have worked in a different way and have met the needs of more people than possibly they would have met if the service had been open.
Day services staff have done a wide variety of things, working in different ways. There have been some who have been unable to go out and do things because they themselves need to self-isolate, are vulnerable.
Yeah.
So actually redeployment into something like that wasn't possible. Some of our staff have been, some of the day centre services staff from across the sector, ours and other providers, have been, apologies for that, have been redeployed into helping package PPE for care providers and delivering PPE to care providers, care homes and to home care companies. A whole vast range of things they've done, including staffing the helpline through weekends. So people have sort of mucked in wherever the gaps are needed, and that's been super.
Yeah.
But I do take the point that making carers visible. There's fantastic esteem for carers in the broadest sense, as I say, but there is also an acknowledgement that the number of carers out there now, almost in every family, they've had to rally around a member of the family who needs support. Yeah. Whereas perhaps that was, so I'm not sure we will ever capture all of those. I think our existing processes are robust in terms of we've been able to grow the number of recorded carers, but I would say most families have one now.
Yeah,
have had one through this process.
absolutely. We've definitely seen an increase in the applications for carers emergency cards, and whilst there's been some screening of that, the percentage of them have definitely increased upon the normal recruitment of those. So Lisa's been particularly busy with carers emergency cards in South Gloucestershire, so and that is across Bristol as well. So yeah, I think, and for some carers as well, COVID-19, some of them have said it hasn't changed their life at all because they were quite isolated before, because they're not able to take breaks because of the types of caring roles that they have. And when we talk to people about taking a break and valuing their own worth and their health, I guess going forward, it's something about how do we plan for these carers to take a break in the future? Is that something that South Gloss is thinking about? How will carers be able to take respite in the future?
I think what we would need to hear is there a do differently ask hidden in there? Because in the points I made earlier, there can be, let's go back to, do people want to go back to what we did before? Or do people say, no, actually, we want to go back to a new normal, to a do differently?
Yeah.
And that maybe is something we would capture through the survey. But very much want to hear where people saying, actually, now what we need is something different. And absolutely, when you've been through a tough period, taking a break is what everybody needs to recharge the batteries. So I think that's a conversation that I very much welcome. I wouldn't pretend to say that we have come to this with the answer. I think we need to listen to what people are saying and the ideas that they have, and for us to go away and see how we can meet that. Yeah. Because it's important that we do.
We're starting that conversation next week with a live webinar around carers assessments as part of Carers Week, and we've invited carers to join that webinar, and we've started taking questions, and I've seen some of the questions already, and they are around what will respite look like. And I think the webinar itself will be interesting. It's our first live webinar, and as you know, we're working on a survey to capture how carers are supported in the future. So I think going forward, in terms of engaging with carers about how we meet their needs as a service provider as well, it's definitely interesting times. And for those people who aren't connected to technology for whatever reasons, then we will need to use telephone consultation and safe social distancing to capture that and share that with our providers, or commissioners rather.
Yes, indeed. I think people will be conscious and aware that local authorities have been allocated finance by government through COVID-19, and people may also have picked up through news media where local authorities' position is that that's very gratefully received, that the total costs probably exceed the allocations. There was 3.9 million allocated from that into adult social care in South Gloucestershire. The majority of that has gone in temporary fee uplifts for social care providers. So we awarded a 10% fee uplift for 3 months from April, May and through to the end of June. Okay. And that's care homes and home care. But we've also, as I said earlier, continued supporting people through lockdown and continuing payments to the services that haven't been able to continue, or at least not in the normal way, so that they can survive and be there when we need them, as soon as we need them again. And we were able to redeploy their staff with their agreement, which has been very helpful. We also use some of the funds to employ more staff providing frontline home care to those leaving hospital, to free up hospital beds absolutely as soon as possible. Yeah. And some of the funding has gone into the 7-day-a-week helpline and the capacity to link with and support the community mutual aid groups, which have provided so much for the. And there's a great kind of groundswell, isn't there, of with so many clinicians in the family and nurses. I have to be out there, and I am out there, have been out there for the Clap for Carers, and that mood that we have in the nation. Well, wouldn't it be great if we can capture that esteem for carers, and I include informal carers in that, going forward, and that I think has to be a key aim for us all.
Yes, yeah, absolutely. Well, thank you very much for your time, John. It's been most appreciated.
Okay, thank you very much, Sam.
Thank you, John.
Thank you. Goodbye.
Bye.